So we learned a very little bit about restorative dentistry, a very small amount. And then we are put into, we're put into this world all of a sudden where we've got to do things instead of 3 hours, we now have 1 hour if we're lucky, right, to do everything that we need to do. And we just don't always gain that. Where I gained a lot of that confidence in the restorative co-diagnosis is from the dentists that I worked with, and their willingness to take the time and draw things out and explain things to me and help me really understand that. And so the first leadership skill that dentists really want to master to get their team to do more co-diagnosis is permission. Because here's the deal. We are told we are not supposed to diagnose, right? And while we all agree that the dentist makes the final diagnosis, sometimes we use this as an excuse to not to do more, not to share more with the patients. We are perfectly capable, and it is perfectly appropriate for your clinical team in general, right, to observe what's happening with the patient and to share those observations with the patient. To observe and document what's happening and to share that with the patient, okay? And I believe it's even appropriate for us to say, in the past, when I've seen this, doctor has recommended X, or doctor has recommended this or this, and he'll come in and he'll give the final, recommendation, okay? So the first step is giving your team permission to do that, permission to observe, and permission to share those observations with the patient. Now, here's the next step, all right? So permission is the first, and we're gonna come back to this in just a second. All right, so imagine this front door of this beautiful home is the door to the doctor's operatory. And your goal is to help the patient get from here, right? This is when they walk into your hygiene operatory. This is your time with them. And this is the doctor's operatory. So our goal is to get them from here all the way into saying yes, that they're ready for treatment. So we've got to figure out what are the different steps to get to there. And part of this permission is, doctors, you letting your team know how far down that diagnostic path you would like for them to take your patients. So some of you might say, I would like for my hygienist to take the patients right here, which is establishing the problem, and then I'm going to come down the steps and I'm going to come right here and I'm going to establish the solution. I'm going to share with them what the solution is. Totally fine. Some of you, we had a doctor in a class recently, and I asked that question is, how far do you want your hygienist to take patients down this diagnostic path? And he said, I want the patients to be ringing the doorbell. So before he comes in, he wants patients to be ringing the doorbell, which means really he comes in and all he has to do is just nod his head and say, yep, I completely agree with what you said, Rachel. Mary, that's what I would do. I would move forward with that right away, okay? So you've got to establish, doctors, where you want what you would like your clinical team to do in that regard, and then you've got to give them permission to do that. And it has to be explicit, because sometimes it's implied and you think maybe they know, but they don't really know. So you really have to explicitly say, I'm giving you permission, I believe in you, and I'm confident, and we're going to continue to work on your skills in this area, but I would like for you to really take this patient all the way down that diagnostic path as far as possible. And then I will come in and confirm the treatment, okay? So that's the first step, is the permission, all right? The second step is the knowledge, okay? So now it's taking that time to transfer your knowledge, doctors. Transfer your knowledge, transfer your treatment philosophy to your team, to your whole team, every single person on the team, right? So that they understand. You and your dental assistants see, you see those cracks underneath the floor of the prep. You see what it looks like when you take out old crusty amalgam, right? We don't ever see that. Your business team never sees that, but it's important for us to know why that is. And it solidifies when you say, gosh, this is really best suited for a crown. When they see what it looks like when you take all that out and there's not much tooth left, they'll understand why. And again, remember, it helps establish that mindset. It helps establish that belief. So transferring that knowledge, this works really well in like a case review environment where you're looking over cases. And then the last piece is the accountability. And the accountability is, I'll give you one example. One example is the use of intraoral photos. So it sounds like in their practice they do a lot of use of intraoral photos, and a lot of times you'd like to see more intraoral photos, but for whatever reason it's not happening. A couple things, just quick, simple, like super simple, obvious things, is make sure that the technology is easy and accessible. You know, one time I was working with this dentist in Houston, and she's lovely, awesome. I still see her from time to time. And I asked her, I was like, well, tell me about your intraoral cameras. Do you have an intraoral camera? She's like, oh, yes, we do. It is fabulous. You have got to see this thing. So we walk down the hall, right? So we're walking here, and she's like, okay, come this way, come with me. And then we go down another way, and then we go down this other hall, and then we come to this little room that looks like it used to maybe be a dark room. And there's a cabinet, and she opens the cabinet, and it's like, blah, there's the intraoral camera. But guess what? Nobody's touched it in like a month, because it's there in that little space, right? And really and truly, you guys are working by the clock, and every step and every minute counts. So the hygienists are not going to get up and walk down 2 hallways to get an intraoral camera out of a cabinet. It's got to be in the operatory. It's got to be right there, and it's one of the best investments that you will ever make, as long as you can all get the commitment that it's going to be used on every patient, and then you hold each other accountable. So here's how this looks like with my doctor is, if there's not an intraoral photo when he walks in up on the screen, he turns around and goes and does something else. And that ticks me off about twice, and then I'm never gonna make that mistake again, right? So it's a little bit of tough love, but if you have agreed as a team that you're gonna do at least 1 intraoral photo on each patient, then we gotta stick to that agreement. We got to stick to that agreement, and that's just one example. You know, maybe it is, you know, and maybe there's already a photo there, but we've just got to have something up on the monitor, you know, that's not CNN when you walk in, right? Because that's a distraction, right? We want the patient to be focused on that. So one of the things you talked about was spending that time with the patient on them, and this is just a little sidebar. But the TVs, if you have TV and different things, it's competing with your expertise and your knowledge, right? So you want your patients to have their undivided attention on you and what you're there to do for them. So just consider that, okay? So accountability, right, is if you're not getting the information that you're asking for in the handoff, then how can we improve that, right? How can we improve that piece?